Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
And welcome to another episode of What the Health. I am Dr. Dan here with my co-host,
Angela. Welcome back, everyone. Got another episode here. As you guys know, we are here for informational purposes only, in no way offering individualized medical advice. Always talk to your trusted healthcare providers. But today, not really necessarily.
I am the trusted healthcare provider today. We're talking about a cool chiro case study, chiro adolescent. I keep joking with Aaron, and I want to be called the adolescent spinal specialist. Put that acronym into place. Dr. ASS.
That's exactly what we call you sometimes.
And yes. I get called that many times under people's breath in the office. We have a good time. Anyway, this was a really cool case that, like you said right before we were ready to jump on, that this dad recognized his teenage son, who has a long history of concussion head trauma, does play baseball and, other sports, snowboarding. Yeah. And so, just one of those kids, which we know a lot of young, boys and girls, just go all in when they're playing, and just, there's no off switch or power, throttle button. It's just, all in full force. And so over the years, he's had headaches on and off. They seem to be getting a lot more regular and more severe in the last 6 months. And his dad also noticed that he started doing this thing with his neck, where he'd, kind of throw his neck to the side and basically try cracking his neck. And parents, we have all seen this with, young kids. I'm telling you, when I go to any type of public event and there's, kids around,
they're all sitting there.
Oh my gosh, I can't tell you. I just got done coaching basketball, and there was one or two kids on the team that I noticed that it was like, they're rolling their shoulders back and they're whipping their head side to side. And, that is a telltale sign that there is something going on neurologically and or biomechanically in the spine that kids are trying to self-adjust and self-correct. And, I always talk about this idea of proprioception, right? So proprioception is the concept that your body knows where it is in space. And it's very subconscious. But if you close your eyes and put your left hand above your head, okay, I don't have to look to see that my left hand is above my head. I know that it's there, right? That the reason I know it's there is because there's receptors in the, joints, in the tendons of the muscles. And so those receptors that are in there basically send messages up to my brain telling me that, hey, my arm is above my head. Okay. Again, I can close my eyes. I can lift my toes up, push them down, bring my leg up, put it down. I know where my body is in space without having to visually see it. That's proprioception. Now, proprioception works hand in hand with with another neurological message called nociception. And nociception is not pain, but too much nociception will put your brain over the threshold to start to recognize that there is pain there. And so when we think of, we're sitting at a desk too long, right? Or we're sitting in a chair too long, and it's like, oh, I just feel tight. I feel stiff. And you go to get up. And this is where, again, we have these conversations with patients all the time. It's like, after sitting for a long time, I go to get up and my knee just aches, or my hip or my back, or, my neck is real stiff. But then I get up and I start moving around and I feel better. And it's like, that's the concept of nociception is taking over when you're seated because you're not moving. And then you get up, and then that proprioceptive messaging starts going into the brain, and proprioception inhibits nociception. So this idea of, kids starting to try and swing their neck left and right and crack it, what they do, what that's doing is it's basically adding a rush of proprioceptive messaging up to the brain. Okay. And it feels good because if your neck is stiff or your shoulders are tight, like, it's just a quick sense of relief. And it's like, oh, okay, wow, that feels good. And it naturally, when you stretch a muscle really fast, it naturally relaxes afterwards. So all of that, is important that this dad recognized, like, hey, you're throwing your head around a lot. And he's doing it all the time. And the kid admitted in his exam process that, yeah, I probably do that, maybe once an hour or something, but it doesn't last very long. It feels good for, a couple minutes. And then I feel like I have to do it again. And there's the key, right? You feel like you have to, again, it's like it's a jolt, it's a hit, right?
Yeah.
It's a high. It's like this, this brain stimulation, this or this proprioceptive input that it's like, oh yeah, that felt good. But then it's like a couple minutes go by and you're right back to it. The challenge is, usually the segments that you can actually get to move and make that cracking, popping sound are segments that are already moving just fine normally, but they're very near segments that are locked up. And so when you have a segment that's locked up and not moving very well next to a segment that's like over moving, hypermobility, that aberrant, that difference in motion, lots of motion in one segment right next to, a segment that's not moving very well at all. You get this sensation of, your body just doesn't know what to do with it. So it's just like these, weird messages of like, the segment that's locked up is creating this nociceptive message, but the segments that are moving are created, this overstimulation of proprioceptive messaging, which is causing, this stiff, tight neck and, can be, leading to headaches. And so at the end of the day, without going too deep into that, again, dad recognized that, hey, my son is throwing his head around a lot and there's probably something not right about that. And so sure enough, we put this kid under our motion x-ray assessment. And the only way, the gold standard of assessing biomechanical motion of the spine is a motion x-ray. You can, chiropractors, massage therapists, physical therapists, they're trained to palpate, right? Mm-hmm. Use your hands to feel different tightness in musculature or feel swelling in a joint or restrictions. But if you, have one, practitioner and, you go down and you have 5 practitioners palpate the same person, they may come up with like, 4 or 5 different answers on like what area, that they would maybe start working on or, what area might be restricted. And so the inter-examiner reliability of palpation is not nearly as high as you put someone under a motion x-ray. And you even saw it, right? And Dr. Riley saw it. And, someone who isn't formally trained, but you've been around it enough that you're like, that doesn't look right. So it's like, and even parents, it's like I can take, 60 seconds to explain what I'm looking for. And then I show them the x-ray and they're like, yeah, that's not moving. Yeah. And it's like, so when we put him under the motion x-ray, it was some of the worst hypermobility in the upper cervical spine, basically. So you have 7 segments that make up the cervical spine. The top 3 were excessively moving. Top 3 or 4 were excessively moving. And then as soon as you got from 5, 6, 7 down, they were all very restricted with very, very little motion between those at all. So again, he was popping and, trying to move his own neck around, but it was causing this hypermobility in the top part of his spine between C1 to C4. But the restriction, what he was trying to get alleviated, subconsciously, was getting that C5, 6, 7 moving better. And again, when the segment's locked up versus a segment that's moving and you put a force into there, where's the motion going to go to? It's going to go to the area that's already moving. And so that's exactly what was happening. And so he was just in this vicious cycle of exacerbating the challenge. And again, we were able to pick it up within, 60 seconds to 2 minutes of doing this motion x-ray and reading it and, and getting, instantaneous, data, on what was going on for real. So, I really applaud, dad for, recognizing that, hey, something's going on here. And, and interestingly enough, dad was a past patient of ours and we hadn't seen him in, several years, but he's like, I'm going to get in touch with these guys. And he brings his son in, and sure enough, we'll definitely be able to help with that. But I see this so often, right? Because kids are very loosey-goosey.
The technical term.
The technical term, right? So kids are very, very mobile. They're not hypermobile because they're designed. They're just, compared to an adult, they're hypermobile. Yeah. They're more mobile than an adult. But, their spines typically move very well. But, I see this where these segments will start to move too much, and they'll be next to segments that are locked up. And without having it properly assessed, then, it can lead to long-term issues because the spine continues to mature all the way up until about 20 to 24 years of age, depending on if you're male or female. Females' spines and, the muscles and ligaments mature a little bit faster. So, usually by 18 to 20 to 22, their spine and skeletal structure has stopped growing. And so the ligaments have reached their tension, the muscles have reached their tension. And then that sets the stage for the rest of their adult life. Men tend to be a little bit later, 20, 22, 24, 25. That's when they, officially, will stop growing and reach their final tension. But if you have a misalignment or restriction, okay, the term we use in the office is subluxation, and it's not corrected before your spine hits that maturity phase, then what happens is now your body starts recognizing the abnormal subluxation as normal for your body. Okay. And I'll ask my co-host, Angela here, do you think that would take longer or faster to correct? If you mature with the subluxation.
Oh, longer.
Exactly. Yeah. So, your body matures with this abnormal compensation or this abnormal subluxation. And, you mature with it. Now it's going to take that much longer to correct. So I really applaud this dad. But, again, this is kind of a call to action for parents who watch your kids, and again, I know all of you do, but sometimes we're just going through, life and we don't even think about it. But another example was a dad brought his son in. He was playing soccer. And again, same idea. His son's a go-getter. He's going to play hard, to do slide tackling. And, he just got off the turf. I think he was playing indoor. He just got off the turf after a hard tackle. And he was just like, you could just see it in his face. Yeah. Right? Kids will never admit it. Like, oh yeah, I'm a little sore, but I'm fine. I'm going to go back in and play. But it's like, you can just see it on their face. Like something's not right. And so, his dad asked me dad's also a patient. He's like, hey, should I, this is what happened. Do I take him to my, medical doctor, or should I bring him in here? And I'm like, bring him in. If I see if I see something going on, I'm going to, we're going to get it corrected. And, again, should correct pretty quickly. You go to the medical doctor, and again, they're not as nearly as well trained when you're talking about this neuromusculoskeletal stuff and the biomechanical alignment of the body. So, their first answer is, well, either, wait it out, take some anti-inflammatories and wait it out, and hopefully it'll get better. If that doesn't work, then, maybe go to the physical therapist, or if that doesn't work, or in combination with the physical therapist, then maybe you need to do some injections or something, go get a cortisone injection, if you go to the ortho. So, and all of that stuff is needed at different times. But in this case, the kid just got hit hard. His lower back locked up. We unlocked everything through a series of 2 adjustments, and the kid was right back to playing soccer after those 2 adjustments. Yeah. So again, it's like parents look for those signs, in your kids, like if they're just walking funny, if they're
we had another one last night too that she called. Her son said something popped in gym class. And so it started out, it's like, oh, I don't know if you need to go to the emergency room he came in and scan was all flared up, and, you adjust him. He was limping on the way in, and 11-year-old kid, and you adjusted him, and it's like he even said, he's like, well, it's not normal, but it feels a lot better.
And that's what I asked him. I'm like, what percentage improvement would you say that is? And he's like, and again, he's a very intelligent kid. So, again, you can ask those questions. Your normal 11-year-old, I wouldn't ask that. Because adults can't even answer that question. Like, what percentage improvement? I'm like, oh, I don't know. But yeah, he's like, oh, probably 60 or 70% better. And yeah, you could see it, like he was walking out of here much, much better. So you're talking about a 70% improvement, from a kid who was limping. Yeah. And again, mom, was paying attention and she knew to, hey, bring them in right away. Like, it makes a big difference, parents, when you've got, when your kids are struggling with something, again, from a chiropractic perspective, or going to the foundation of the spine and really the intimate relationship of the spine with the nervous system. So if, the nervous system is under stress because the spine is locked up, and if we get the spine unlocked, then the nervous system calms down. Now muscles start firing more efficiently, joints start moving better. So just biomechanically, the body's moving better and functioning at a much better level. And again, there are times, I adjusted one young adult, one adolescent several months ago, and he got like 50 to 60% improvement with the one adjustment. But, he's still having some nagging pain. Now, again, his parents told him, you need to take some time off of soccer, dude. And, again, he didn't want to, and he just kept pushing, and he just kept having this nagging pain in the back of his leg. Finally, he went to they went to an ortho or a sports med doc, and who ordered an MRI. And sure enough, he had a, hamstring tear. And it's like, if you want this to heal, you need to stop playing, and you need to give it time to heal. And I think they finally decided on the cortisone injection didn't do anything. I think they are going to be doing some PRP injections, which again, I think as a wave of the future, it's finally being accepted more and more, especially for soft tissue injuries. I really feel, we have a good referral relationship with a lot of, local docs who are doing them. It's starting to be accepted more in mainstream medicine. But, this whole idea of, hey, we're going to take your own blood or platelets and centrifuge it down and then do that and inject it back into a joint or a tendon or a muscle, and allow your body to, stimulate a healing response through that. That is just, that's cutting edge science. Oh yeah. That's cutting edge stuff. And I know you had a great experience.
Yeah, it saved me.
Again, at the end of the day, it's not gonna, you still have to stop and rest.
Oh, well, yeah, right? Absolutely.
But yeah, what that allows someone to do with their healing response from a soft tissue injury is, really just amazing stuff. And I know a lot of people are starting to, do research and do that more and more. Yeah. So, with that being said, you still need a good, healthy, moving spine. Yeah. And that's where we're the expert in trying to help people understand. It's like, okay, yeah, you can go get that shoulder injected or you can go get that hip injected, but your whole pelvis is rotated left to right, or your neck is, completely reversed. Like, no amount of injection is going to fix that. So, let's start there. And then, whether we, work with another doctor at the same time or switch back and forth, we're able to come up with a customized plan for, you and your family. Which is just so nice. But I love working with these kids. Oh yeah. And again, I love working with all ages, but kids just respond because they're loosey-goosey. Yes. They just respond so well to care. So within a couple of adjustments, we can see massive change, and improvement in their bodies and their overall function, just after a handful of adjustents. So, again, adults just we have a little bit more life experience. Yeah, a little more wear and tear. Yeah, a little more wear and tear in our body. So again, adults are great to work with, but, seeing that stuff in kids, I really wish, I really wish just that everyone would know to bring their kid to a chiropractor from a very, establish your family with a good, family chiropractor. And, it's so interesting to me that everyone will take their kid to the dentist, right? Mm-hmm. Oh, your teeth are popping through, 2 years old. It's like, all right, let's get them to the dentist. It's like, if you knew how amazing, your spine is intricately related to your nervous system, and you started, analyzing that and fixing any of these mild subluxations, these restrictions in the spine, and get them taken care of from a very, very early age, and check it regularly throughout your life. And regularly could be, Could be once a month, could be once a quarter. Some people, depending on their lifestyle, you know, if you're going to go, we've got one kid who comes in and he does bull, cow wrangling, right? So
what's it called?
I don't even know what the
something the rodeo,
something rodeo, but he does, you know, like the cow where he takes the cows down, you know, or the calves down.
Yeah.
So it's like, you know, you do something like that, you might need checked a little bit more than once a month because you're beating the crap out of your body. We had a gentleman come in yesterday who's trains police officers. And, you know, he went full force, you know, teaching them grappling techniques and stuff. And they were like 40 hours the one week. And, you know, he was like in massive amounts of pain. And, you know, we got him, you know, probably 70, 80% better after his one adjustment. And he asked me, which I, you know, really had to like hold my laugh. But he's like, well, what do I do what can I do to prevent this? I'm like, don't grapple. Like, I don't know what to tell you. Like, our bodies are not designed to be put in that level of, you know, restriction. Especially once again, things do change as we age. And so, you know, once you get into your 30s and beyond, like the restriction in your, you know, in your spine and in your joints, it does start to change. And if you don't, take action on a, you know, daily, weekly basis to keep some good flexibility in there, then yes, it does, you know, it does degenerate. It deteriorates, unfortunately. So, but that doesn't mean there's not room for improvement. Right? There's many stories of people well into their 50s and 60s. That's when they really take their health into their hands. You know, they've worked their career, they've raised their kids, and now it's like, all right, now it's
all me.
Now I'm going to take care of myself. And again, you see amazing stories of flexibility and strength and, you know, these feats being hit of, you know, people well beyond 60, but they start in their 50s or 60s, they start taking care of themselves. And now they're getting into the best shape of their life, literally, you know, in the second half or, you know, last third of their life. And so, you know, there's no time is too late. But again, it would just be so much easier on us if we started from an early age. And, you know, we imagine, again, I had a mentor, you know, talk to this about with his patients. It's like, imagine we start a baby, they're born into this world. Okay. And they're checked by a chiropractor. Okay. And any sort of, you know, spinal restrictions, we're able to clear up right from day one. And then we check that baby, you know, once a month or, you know, once every other week or once a quarter throughout their life. By the time they hit that spinal maturity at 20 to 24 years of age, what is the health of that child going to be? Pretty darn good chance that they're going to be darn near optimal health. Yeah. But what we unfortunately do is the average person doesn't even see a chiropractor until they're like, you know, mid 30s or 40s. And, you know, and then we wonder like why we have all of this, you know, damage to us, because it's like we've never invested in it. So, yeah, I'll get off my soapbox. But again, you know, it's making sure that you're going to a good practitioner who understands, you know, is able to visualize and read X-ray. Hopefully they're having X-ray, because if you're adjusting a spine, you know, should really be looking at it, you know, and having other tools available to be able to show that your body is in fact progressing, you know, from visit to visit and, you know, month after month, year after year. So if any of this resonated with you, Angela didn't take a nap. No,
I was here.
She said that she was going to.
I was listening.
But yeah, thank you for allowing my soapbox. But I just wanted to share that, you know,
I wanted you to, because I mean, again, this just happened. This one wasn't planned. You know, we had planned to do a podcast today, and this all just happened literally all just yesterday. Yeah. So it's just, I like when you share stuff when it's fresh and excited about it. And because again, it's at the end of the day, we always say it's easier to raise healthy children than to fix the correct sick adults. So it makes it easier for everybody, like you said, if we start from a young age. And, you know, like you said, it's great that his dad brought him in at 16 and not 26 when,
when you know, really suffering. So, yeah. And again, it's just recognitions. And like I said, you know, parents, okay, so just tell me what to do, Dr. Dan. So again, if you recognize that your kid, you know, is wincing, like if they're, you know, after a sporting, you know, event or, you know, after practice, and they just, you know when your kid isn't feeling well, you see it on their face, you see it in their energy level. So, you know, if you see that would be a good time to get checked. If you, if you see
them,
if you see them, trying to whip their neck around,
or like kind of doing that,
they're digging into their own musculature, or they're, trying to move their lower back and, bend and twist and in a forceful way, not stretching.
Yeah.
And they're really trying to, move something in the spine. That's a good sign that, hey, you should get something, get that checked out. If you just, you just feel like, compared to other kids, your son or daughter is more sluggish. They're, having attention difficulty in school. They're not sleeping. Like that's another, neurological, could be a neurological foundational issue that could be, assessed and improved through chiropractic care. So, all of those, and if you just honestly have your child, stand in front of a mirror, and without their shirt on, if they're comfortable, depending on what age and they're comfortable with that, like you can look at their shoulder height. You can look at, if their head is rotated one way or another, if they're tilted one way or another. And then simply, I always say, just have them turn to the left all the way with their head and then turn to the right all the way with their head. If you can see a noticeable difference left or right, or they can feel like, oh yeah, it's a lot harder to go to the left than the right. Like, that is an obvious sign that, that there is something restricted in that spine that could really be improved through chiropractic adjustments. So, again, at the end of the day, we also have a lot of the signs, in our book, Designed to Heal. So if you don't have a copy and would like a copy, please reach out to us. We will get you one of those. There's a lot of good signs, that we have, parents look for in their kids on when is a good time. But at the end of the day, if you have a spine,
anytime.
Anytime.
Now.
If you have a spine, anytime is good. Just like, you have teeth and, you go to the dentist before you have cavities and start to hurt.
Yeah. So, you don't wait till they're falling out.
Exactly. So it's like, even if you're not in pain, like, hey, never been to a chiropractor before. My kid's never been to a chiropractor before, but I've always wondered about this. Could this be, related to the spine and the nervous system? And, if you go to, an honest, good, practitioner, they're going to let you know if they can help. And if they can't, hopefully they'll do everything in their power to find you the right fit. So that's my, Dr. Dan, adolescent spinal specialist.
Yes.
Get your kids adjusted, get your kids checked and adjusted when necessary. Mm-hmm. So with that being said, I'm Dr. Dan with my co-host
Angela. If you guys are interested in looking at more information or making an appointment, check out our website, Turo, familychiropractic.com. We have a ton of content on there. Like we always say, we give out too much content, but we'd rather people have it than not. And there's an entire section on, with kids and the different conditions that they might, be dealing with. So again, if you need some more, if you're that kind of research minded, please check it out. There's so much information on there.
Absolutely. And we will see you next time.
Yes. Thanks, guys.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.